Okay.
Okay, so this is our group. I'm Aaron, this is Shayson, Daniya, and Andrew. And we're going to be talking about the Vinci surgical system. All right, so in general, surgeries are usually performed by mechanical tools that the surgeon will actually use to cut you open and see what's wrong with you or try to remove something that could be causing you some distress. And these are just usually scalpels or scissors and something we're all really familiar with. A laparoscopy is a form of minimally invasive surgery, which is the new thing to do nowadays because it reduces hospital time and scarring and so forth. And what laparoscopy in general really is you get your abdomen inflated with CO2, and then what the doctor will do will insert a tube that has a lens on it, and it will input an image of whatever they're looking at, and it will go to a monitor. So the doctor will actually see what's inside the stomach without actually having to cut inside. So it'll reduce actually the scarring. So then the doctor can actually insert a really small version of a scalpel or a scissor or something else and do his surgery while looking up at the screen, and then just perform the surgery. However, this will actually distort his hand-eye coordination because he's actually performing it right down here but looking somewhere else, so it could be kind of weird. So with the Da Vinci system, we have a few motivations. So obviously the doctor is a human, so he doesn't have the dexterity that a robot can have. He can't move his arms and crazy things like a robot can. So the Da Vinci system will actually increase the dexterity performed during the surgery. It'll also relieve all the ergonomic stress the doctor will feel, because during a laparoscope, he has to be standing up to do the surgery, and then in the Da Vinci system, he's actually sitting down looking at a console, which we'll talk about later. You're actually going to have an improved visualization because the Da Vinci system actually has a real-time 3D picture instead of the 2D visualization during a normal laparoscope. And you're going to have natural hand-eye coordination because he's going to be in a console that looks like he's actually performing the surgery while in it. So here's a picture of laparoscopic surgery. So you can barely see any scars because the incision is so small. But from an open surgery, he has a very large scar. So this is what we see with people who have like open heart surgeries back in the day that have a large scar over their chest. So the benefits in general of the laparoscope, as I said before, least hospital stays, it saves money, quicker healing time, reduced chance of infection, and like I said, the scars would not be much.
I'm going to talk about the Da Vinci system, which is our topic for today. This is just a general schematic of what it looks like. So the Da Vinci system?
The Da Vinci system is the most advanced surgery.
Okay, I'm going to go ahead and narrate it. Okay, you can see here's the surgeon at the main station, and he can see through this port here. It allows for stereo vision, so it's just like in real life, it would be 3D. There's 4 different hands that you can use. There's an endoscope, and that's what allows for the 3D vision. Here you can see there's many different attachments, and Daniya's going to talk about the attachments in a minute. So it allows for a wide variety of surgeries that can be performed. Just like in real life, he's using his hands, and those movements with his hands are scaled, so it can be very accurate, and they can also filter out any jitters he might have in his hands to also improve accuracy. And so this also helps with, recovery time and things of that nature. Yes, there is a surgery, so don't freak out. This improved accuracy will lower your hospital stay time, and that's something that Andrew will talk about. You can also have more than one person work on it at the same time. Here you have the main surgeon, but he can also have a second person. You only have 2 hands, but there's 4 arms, so you can have all 4 arms in motion at the same time, and they can work together. And this will allow for faster surgeries to be done. So it's pretty amazing. Small incision, only about 1 centimeter to start with, and it's filled with carbon dioxide. This allows for much lower recovery time again than the traditional gold standard of open surgery or even laparoscopic surgery. And
okay. Next one. So as Shayson was mentioning, there's 4 arms, and you can put different instruments in it. Basically, they're called endo-risk instruments. So over here we have advanced energy instruments. These instruments actually are electrosurgical instruments. So it gives a current through, and it helps burn through tissue basically. And these are forceps, which are basic grasping tools. Needle drivers to help suturing. retractors, which help keep open the surgical field. The nice thing about having retractors as an instrument is that it minimalizes the dependency of the surgical assistant, and so it's more dependent on the doctor, on the surgeon who's basically doing the surgery, and then you have your specialized instruments for your not every day-to-day surgery, basically, and your 5mm instruments, which are help go into smaller spaces. And Shayson went into a lot of these, but just to kind of go into depth, the instruments actually have 7 degrees of freedom, which is really amazing because that's how much you have in your own wrist and arm. And so that's a really step up from previous robotic surgical instruments. And basically, it has an ounce to several pounds of force that you can apply onto the patient. And when you actually move your hands, it filters and scales your hand movement. So if the surgeon kind of jitters a little bit or something, they shouldn't, because they're surgeons. But if they do, it helps kind of smooth out the movements and make sure that it's not, going in a different way. And as Teresa mentioned, there's 1cm incisions. You can magnify it from 2 to 10 times, and when you do magnify it, it scales the movements accordingly. It has a really good viewing system, 1,000 frames per second, so it's really fast, and it eliminates background noise. And one thing about it is that it has a binocular system, as you saw in the video, so it helps, give a real image, basically, as if the patient was right there. And it also, the endoscope actually regulates temperature, so that helps prevent clogging, which Dr. Park mentioned was an issue with some of the endoscopes out there.
Yeah, so some of the limitations of this system is that you can't use it in children because children are too small for it to really be effective. And then you can only use it for simple procedures because they just aren't there yet with doing more complex. And you lose haptic feedback, which is basically means that the surgeon loses like tactile touch of actually touching tissue and touching the patient. So some advantages and disadvantages is that you have minimal incisions, like Aaron said. You have better technique, you're more accurate. You can only use it for simple procedures, but it's still an advantage. You have higher depth perception, and you have increased precision, and you can do it solo instead of having nurses or other surgeons, which actually reduces costs as well because you don't have to pay them. There is a steep learning curve. Most surgeons say it takes about 8 to 12 patients that they do surgery on before they feel comfortable with it. There's a high cost of equipment. The machine usually costs about $1 million or more, plus the training to teach the surgeons. You have reduced workspace because, as you saw in the video, you're in this console thing that you don't really have peripheral vision besides what you're looking at, and you lose the touch sensation. So here's some numbers between the Da Vinci system, laparoscopy, and then open surgery. So you can see that the operating time for Da Vinci system is actually the shortest. You lose the least amount of blood, and you have lower complications, which is about equal with laparoscopy. And then the big thing is you reduce the average hospital stay, which again lowers costs by quite a bit.
All right, so in conclusion, using the Da Vinci system will reduce operation time, blood loss, and hospital stay, as I just mentioned. This will result in a quicker, cleaner, and more accurate surgery because it's done by a robot and not by a human, so error is minimized. This is a really good example of a modern example of the machine-man interface in the medical field.
Currently, how do they decide when to use it in a surgery, just normal surgery?
So basically, like we said, it's only for simple procedures. So like hysterectomies and, taking out your uterus. It's not,
But also they already limit down to certain surgeries to start with. When they first open up, make that initial incision, the surgeon will decide if it's an appropriate case or not to even begin with the surgery. So if they feel like they're not comfortable doing it, they can go back to laparoscopy or even open surgery.
If I needed surgery, could I request that as a patient?
Oh, well, I'm sure you can request it. I don't know if they would grant it. Different things. But if they feel that they're competent in using it in that procedure and they still feel comfortable after that initial incision, then they'll continue with the procedure.
I don't know if you guys know this, but how long does the training take, for the doctors, to actually go through and be trained properly for the procedure? How long is it?
I mean, I don't know what time-wise, but I know, like Andrew said, it takes around 12 patients. So it could, I mean, it ranges, I guess, from doctor to doctor, but around 12 to 18 patients, that's when they start feeling a little comfortable with it. Because it is, you know, obviously very different from an open surgery.
What's the surgery that they practice on first for the admission?
What do they practice
Like,
on?
what's the standard one that they first decide to use it?
The most common one is removing the gallbladder.
Okay.
Yeah.
Yeah, but if you go on YouTube, you can actually see videos of them like peeling grapes. It's pretty cool. But yeah.
It's very accurate. It has a very high low tolerance, I guess, for accuracy or error. And each arm has a chip, so when it starts to get out of tolerance or a certain amount of use, it won't work anymore, and they have to either get it calibrated or replace the whole arm. So it keeps track of how often it's being used.
Do you guys know if they have some sort of video game to practice with? Kind of like for like the people who drive jets, they have like this special like game. Simulation, I guess. Do you guys know if there's any?
Well, I mean, like I'm saying, it is a great, so.
You know, do weird stuff. I guess that's something. Like, I think because they wouldn't really want to simulate it, they would actually want you to use the real one, you know, so you can get the real
Yeah, but it costs like $1 million to get one and use the real one. So
Yeah,
we didn't
and
want
it's
to
about like 400,000 I think a year to maintain and it's a lot.
You know if they feel like a pressure or drawback of the skin? Like, do they?
No.
Well, you have the amount of force that they can feel, right?
Like, well, okay, I think, well, from what I read, I think it's the haptic feedback is only limited to the instrument. So soft tissue is very limited. Like, they won't feel as much feedback when they're touching the actual soft tissue. It's more like if they touched another instrument, then they're going to feel that force.
Last question.
Junior?
How many places actually have it? Do you know?
There's like under 1,100 sold worldwide. So, I mean, it's $1 million a piece and 400 a year, so.
Close by, they have it at Loma Linda and at RCH, Riverside Community Hospital.
Okay. Let's go to the next.